think we are ready to go. Thank you so much.
No problem. Thank you. First of all, I want to take a moment to thank Professor Udayan for inviting me here today. I know I was talking to him the other day, and then he talked about this club, and I'm truly honored to be speaking with you all. Considering this is my, your first, guest speaking also, right? Um, so so I want to talk about something that shaped not only my career but also from my perspective on what it means to be an engineer. Now you might be wondering why we are still talking about COVID work in 2025. Haven't we moved on? That's a fair question to start. The reason is that we built COVID, whatever we built during COVID, it wasn't just a temporary patch for an emergency. It actually became a playbook for resilience, a real world case study in how data engineering, when done under pressure, can literally save lives. It was not just about numbers; it was about people you are dealing with, right? The lessons we learned, go far beyond the pandemic. They apply to any crisis you will face, whether it could be a cyber attack or it could be a natural disaster or even an expected system failure in your future workspace. For me personally, this project was unexpected. I was originally hired by my organization to work on modernization, things like migrating old system to the cloud, improving pipelines, optimizing them, standardizing data. But almost overnight, when COVID hit, that work had to take a backseat. Suddenly, we weren't just modernizing for efficiency; we were actually, fighting to keep our, 13,000 odd healthcare workers safe, so hospitals and all the administrative sites can stay open. So that is one of the biggest lessons I want to leave you with today. As engineers, like, you need to be ready. You may walk into a job thinking your challenges about speed or cost savings or designing an efficient application, right? And you wake up. So that pivot from, let's say, modernization to outbreak prevention is why this story is worth revisiting even in 2025, I felt. um, so let me a brief background so that how I got here. Like at forces, um, I had an opportunity to travel to Botswana, and then there were lots of ATM transaction errors. That's when my interest towards data started to grow. One small data error actually created a lot of chaos. Like you made a transaction, you withdrew money, but it was showing that you were doing loan repayment. That can created a lot of confusion. That's when I understood like how sensitive data is. Like even a small data error, it can easily erode your trust at scale. Then I moved to Accenture, healthcare data pipelines there for HEDIS, which is one of the most important report card for insurance companies. The deadlines were brutal there. Weeks of file generation and validations were there. We actually managed to cut down all that from 15 to 20 days to just within 2 days. It made a huge difference because providers got paid faster, the patients avoided delays, and even the company got a lot of federal incentives. And in 2020, I joined Carillon Clinic, which is a large healthcare chain in Virginia. The original plan was to work on modernization, moving all the legacy systems to Snowflake, improve governance, and make it future proof. But when COVID struck, the mission totally flipped. Instead of modernization, the job became survival. Today at Vanguard, I work on large scale data optimization and applied AI. Work with your user experience, how I can derive the intent and may summarize all your digital transactions. But whatever experience that I had in career and whatever it taught me were the lessons that I have carried ever since now. So with that, let's step back a bit into early 2020. Hospitals back then were totally overwhelmed. Like you probably saw images in the news. Doctors in full PPE, like ICUs at capacity, beds were running out. There were exhausted nurses everywhere, like working 12 to 15 hour shifts continuously. At Carleon, even every single day, thousands of staffs were walking into hospitals and clinics, but no one knew who was safe, who got exposed, who had very little symptoms, and who was cleared to work. So the process place relied on manual phone calls, like you have to fill up paper forms, you have to fill up spreadsheets. So imagine thousands of people calling one occupational health line every morning, waiting for someone to manually look into it, take a checklist of it, and say yes or no. It was actually collapsing under the pressure. And here is the most important thing. So this wasn't about systems failing, right? It was about people's lives. A missed phone call or missed, you filing to miss, file a paper could mean an infected worker showing up at the hospital and risking dozens of other, not just your healthcare workers, even you're putting, patients at risk. The stakes that we had were of human. So at Carleon, right? I mean, we had around like 13,200 healthcare employees across 225 administrative sites. The challenge had three dimensions. First was the scale. Like this wasn't about tracking few cases; it was thousands of assessments done every single day. The second was speed. Like imagine you are a nurse, it's at 6 a.m. and you need to know if you are cleared to go for your work at 7 a.m. You don't have days, you don't even have, have hours. You need to have an answer instantly right now. Next was your accuracy. Let's say if you clear the wrong person, right, you risk spreading the information, infection in an ICU. If you wrongly block someone, you leave a critical team member understaffed. So the margin was, very, very essentially zero here. The question became like, how do you build a system that can scale like Google, like make decisions like an airline check-in system, and be as accurate like a medical test for you, on all under critical pressure. So when you are facing a problem at, at this massive scale, right, thousands of employees across hundreds of facilities we had, the instinct might be to immediately start building a giant complex platform, but the truth is complexity will actually slow you down. And in a crisis like this, time is everything. Every minute mattered, every second mattered. So instead of building everything at once, we asked ourselves, like, what is the simplest version of this system that could actually make a difference tomorrow? So we sat with infectious disease specialists, infectious disease directors, administrators, and the consensus was that three data points mattered the most. First is your daily symptom surveys. So these weren't long or fancy, just a quick 2 minute check that staff could fill out before coming to work. Think of it like a boarding pass before a flight, a simple step that gets you cleared for the day. We adopted the same technique here. Second is the test results integration. So instead of waiting for a phone call or a fax, from the lab, giving you the results, right? We pulled the results directly into the system. That sounds very small, but imagine the difference. What once took hours of back and forth, suddenly, it updated automatically. And third, comes your vaccination and booster status, which came very late in the day. So, but this actually let us adjust the risk depending on the immunity. Someone vaccinated with a recent booster was not the same as someone unvaccinated. So the beauty of starting with these three was that it kept us very fast. It kept us focused. It allowed us to build trust with the medical staff right away. They didn't need a complicated black box. They needed a system they could understand, they could verify anytime, and they could rely on. So let's look at the system we built. So how did this all look in practice? Before our system came to play, the process was completely manual. Imagine this wakes up with, let's say, mild symptoms. Sometimes it could be false symptoms, it could be an actual COVID symptom also. So she has to call occupation, and she has to wait on hold. She has to explain the situation and then wait again while someone flips through a checklist, or let's say a binder of rules. Hours might pass before she gets to a decision. Even then, the decision could vary depending on who she talked to. Now, contrast that with what we built. The nurse fills out a short digital survey in the morning. The system automatically checks her responses against the lab data and vaccination records that comes from Epic systems. Within minutes, she gets a notification on whether she is cleared to go for work or not. Her manager would get the same update at the same time. So there are no delays, no inconsistencies, and no endless phone calls. And because everything was rules driven, the decision was consistent. Okay, if you were encountered with these symptoms, yes, you are at risk for COVID. So the decisions were consistent across the board, whether it was 6 a.m. on a Monday morning or let's say on or midnight on a Saturday, the logic was all the same, and every decision was logged. So we had a complete audit trail for complaints and investigation if needed. So that shift from manual to automated, from inconsistent to consistent, wasn't just about efficiency, but it's about trust itself. Healthcare workers trusted the system because they knew it wasn't arbitrary, but it was all systematic. So let me walk you through the flow. Every morning, staff would log in and they would fill out a quick digital survey. That data didn't sit in someone's inbox; it went straight into the system, which combined it with the test results and vaccination data. From there, the system applied a set of medical rules, which we had lots of workshops and intense, war room discussions with the infectious disease directors to come up with those rules. And instead of spitting out complicated medical jargon, we decided to go with traffic light decision. Red means you have to stay at home. Yellow means you might have restricted, duties, and green it meant you are clear to go to work. So how we would determine red, yellow, and green? Red would, based on the answers that you log in. Let's say during the time of COVID, every hospital you entered, they had a set of questionnaire. Did you travel in the last 10 days? Did you meet anyone who had symptoms of COVID? Are you having any of these symptoms? So we had about 10 to 15 questions based on which we applied rules, and then we determined what is red, what is yellow, and what is green. And why traffic light jargon? Because everyone understand them instantly, right? I mean, red means stop. I mean, yellow means you may have to wait, and then green, you're good to go. No training needed, no ambiguity there. Imagine you're a manager with 15 to 20 staff reporting in a dashboard of red, yellow, and green is something you can act on it right away. So that metaphor turned complex medical clearance into something as simple as a glance. And in a crisis, that kind of clarity is very cold and it's very timely as well. So what happened when we rolled this out? So the results were better than what we initially anticipated. The clearance times dropped by 90%. What used to take hours for us, sometimes an entire morning, now happened in minutes. Errors fell by 95% because we took the manual calculation out of the equation. No more risk of someone forgetting a detail or misreading a chart. Administrative tasks saved about 75% of their time, because they weren't buried in paperwork or endless phone calls. That freedom they got to focus on to something real patient care. And technically the system had about 99% uptime throughout the time, even during the biggest surges we had during you know between Jan and June 2021, where we had the biggest surges, when cases spiked and even the data volume exploded. Our system stood up. So the reliability was very crucial there, because if the system had gone down even for a few hours, the trust would have been lost. But beyond numbers, there was something more important. The staff reported they felt very safe. They could walk into work knowing that system protecting them was consistent and systematic. And in the middle of pandemic, that kind of peace of mind was very valuable. Let's quickly look under the hood. Like, we built the system on AWS with Snowflake as the core data warehouse. That gave us scalability, even during the times of case surging. Right, the system could handle it. The workflows that we aren't triggered by fancy serverless functions. We just use a server a scheduler that we built in-house tool, to orchestrate every workflow we had. It may sound simple, but at that time, reliability mattered more than complexity. You might have hundreds and thousands of new tools coming up with fancy names, but during those times, um, all it mattered was something your healthcare workers can rely on, something simple and something easy to deliver. Every survey, every clearance run, it all happened on time without fail. And of course, everything had to be HIPAA compliant as well. That means encryption, strict access control, and even audit trails for every decision we did. Now, here is the interesting part. Even though I was hired for the modernization, right? Snowflake migration, secure pipelines, governance, that was supposed to be my job. But when the crisis came, those same modernization skills became the foundation of the emergency system. So, in short, the modernization work didn't disappear, it became the backbone of the crisis response. That's another lesson for you, right? Even if your original plan challenges, the skills that you bring will definitely find its place. So, this project taught me like um, very important lessons that I carry everywhere. First is always start simple. We launched version 1 of the system in just 2 weeks. If we had waited to build the perfect system, it would have been too late. Many lives would have been lost, many would have been infected, and there were long term impacts as well. Sometimes the simplest solution deployed very quickly is the one that saves life. Second is how we can effectively design for scale. We started with about 100 users, and within 3 months, we were supporting about the entire healthcare, chain, which had about 13,000 employees. If we hadn't planned for that kind of growth, the system would have collapsed under its own weight. Next is building the trust. In healthcare, people aren't just using our system, they were trusting it with their health and jobs. That means you cannot cut corners. Reliability and transparency aren't just features, right? They are your essential requirements. Here's a small example. In one meeting, one of the healthcare nurse told us, like, I don't care if the system says yes or no. All I need to know is it's saying the same thing today as it did yesterday. That's what trust looks like to you, right? So let's fast forward to today, and the system has evolved far beyond and what we built in those first few months. Now AI is everywhere, right? Now we are integrating AI powered risk assessment, like what we used to have a rule based system back then. Now we have a system that can learn pattern for you. We are using predictive modeling to anticipate outbreaks even before it happens. We are experimenting with wearables. Imagine you wearing a smartwatch that tracks symptoms in real time. So we are thinking of adding dashboards that give administrative a complete view at a glance. But perhaps the most important part is explainability. Healthcare workers don't want a black box, right, which is complex for me to understand. They just want to know what the system says, but why it says is also, like, that's how you build long-term trust. What started originally as a stopgap crisis-driven tool has become the foundation for occupational health monitoring. And that's also a powerful lesson here. Emergency solutions, if built on proper and strong principles, right, it can evolve into long-term innovations. Whatever we started as a rule-based system, that what is evolved into the AI part of it. So everything is connected. So why am I sharing this with you? Because you as students, it's easy to think like any kind of engineering, data engineering, software engineering, it's all about queries, building data pipelines, and building applications. But behind every data set, there lies a story of a nurse, a story of a patient, or it could be a community as well. Your code might look like lines on a screen, but it saves lives. Your systems can keep the people safe, and your decisions whether to make it something simpler or scalable, right, it can have ripple effect across the entire organization. The next crisis, whether it is another pandemic or natural disaster or something we haven't imagined yet, right, will need engineers who can step up under the pressure. and that could be you as well. Now, I want to talk a bit directly to you as students, because this slide is really about you know what all of this means for your and all our journey, right? When I think about what you're learning here in the classroom, let's say problem decomposition, let's say system design, let's say collaborative development as well, right? It might sometimes feel very abstract to us. You're working on assignments, maybe group projects. It's easy to wonder, will this really matter when I'm out there in the real world? So let me tell you, it actually does. In fact, it matters more than what you can imagine, because the world won't hand you problems neatly defined and with clean data and with clean requirements. In real life, problem comes very messy. Take the first point. When I was hired at Carleon, my job description was about data modernization, data modeling, snowflake migration, improving pipelines, optimization, this and that. But when COVID hit, right, the problem changed completely. Suddenly, the data was not about improving efficiency, it was about protecting the healthcare workers' lives. There were no perfect requirements, there was no proper playbook, it was ambiguity in its very rawest form. And that's when the ability to work with uncertainty became just as important as my technical skills. You will face that too. And the students who learn to be comfortable with ambiguity will be the ones who really thrive. Next comes a combination of technology and teamwork. The best solutions are never built in isolation, if you see. I could not have built the COVID contact tracing platform without working hand in hand with the doctors, your infectious disease directors, nurses, administrators, and some specialists as well. They weren't engineers, but their input shaped every decision. Most of the times, when you graduate and then when you join a company, right? I mean, you will be getting to work with people who does not understand anything technically. You have to be in a position to talk and tell a story from a non-technical standpoint. For example, they told us which data points were critical, which rules couldn't be compromised, and what stuff would actually trust. But your side, you would be thinking from technical standpoint, like, okay, this is the data point that they are looking for. This is how I could arrive at this particular result. So the role was not just to code, it was to listen, it was to collaborate, and to bridge the technology with whatever human expertise we have. That's something you're already practicing here in group projects. So never ever underestimate how important that skill is. Finally, try to make start making that impact today. One of the biggest misconception I had early in my career was you need decades of experience before you can actually make some difference. But some of the ideas, some of the best ideas I would say on my team during the COVID came from our junior developers, people who are fresh out of the school, people who are interns. Why? uh, because they were not afraid to ask fundamental questions. They challenged assumptions. Whatever we laid out, they challenged every one of them. They noticed the things that even a seasoned professional overlooked. That kind of mindset, right? Curiosity, be it boldness, and the willingness to speak up is what creates impact, not the number of years on your resume. So have that on your mind. So here is my encouragement. So don't wait. The skills you're building here at Mary's aren't just preparing you for something for a future. They are equipping you to contribute right now. Whether it is a research-based project, let's say hackathon or an internship, you already have the ability to make some meaningful contributions. So use all those opportunities. And remember, every line of code, your every system that you design, everything has a potential to impact real people lives. That kind of perspective will transform you from just an engineer into a problem solver that the world can rely on. So to close, let me come back with where I started. So the job that I thought was replaced by the job that the world needed me to do. That's the reality of an engineer. sometimes you don't get to pick the problems. Like you do get to decide how you can effectively respond. Here is the truth, right? It wasn't just the system we built that mattered. It was adaptability, the willingness to change the direction that was catering to a different need, and the ability to focus on something impactful. That's what carried us through. Yeah, thank you so much for your time. If you have any questions, I'll be happy to take it now. But here is my LinkedIn and here is my ADP list profile.
Thank you so much, Mr. Venkatesan. I do have a question. I was wondering, do you have any, or did you have any ideas or designs in mind that you didn't go through with in the early stages?
That's a good question. So when we talked about the first 100 users, right? What we did was we didn't think of the scale initially. We didn't know how much of an impact COVID is going to have. What we did was we did everything on a non-object oriented way. Everything was like not modularized. Everything was done instantly because at one end everyone were getting infected and at another end people were losing lives too. We just wanted to have the system ready so that we can track effectively how our healthcare workers can get back into work. Over the period of time, when we had some breathing space, we decided completely onto object oriented approach. That's when we saw a huge leap in performance improvement, I would say. Previously, for a healthcare person to get notified whether you're good to go to work or you should be staying out of work, it took about nearly close to 1 hour. Now, after the design approach change, we were able to bring that down by 15 minutes. Again, 1 hour, 15 minutes, not a big change, right? But you think about it, like in 45 minutes, how many people you could save, how many people you could prevent from being infected. So the point here is simple. I mean, not always you may have to follow the design principles. You may not even have time for it. But when you think you are ready for it, I mean, that's when it whatever you learn will come handy.
Thank you so much. Does anybody else have any questions?
Yeah, so your kind of future work, you're talking about AI, like using AI to help make decisions. How does HIPAA compliance fit into that? Like, what sort of things are you thinking about as you seek to improve this? The product.
Right, from the HIPAA complaint standpoint, right? I mean, the data that we currently I'm with Vanguard, but when I talk with my previous company or with any healthcare people, like this is what they are thinking. Like the data is going to reside within your virtual private cloud, and then to have it compliant, everyone is going towards privacy based survey. Previously it used to be like you need to have all of your details jotted down, right? The same application could be applied across any of your infectious disease, like that could happen in the future. A good example is this is from India. So in India, like for tuberculosis infection, it followed the same pattern that COVID was also following. For example, you need to inform the government saying that you are getting infected, right? So from rural areas where everyday life is dependent on their everyday ways, not many people were willing to let their names out there. Now with the advent of AI and with putting all them together in a privacy based system, and by therefore being HIPAA compliant as well, right? That's how the target is going towards now.
Questions? Okay. All right. Well, thank you so much, Mr. Venkatesan. Do you have any closing remarks or anything?
Or any questions for us?
Or any questions for us?
Thank you so much for this opportunity. I mean, to, you know, talk from the industry standpoint, I always felt like, you know, that bridge has to happen, because back when I started, you know, doing my undergraduation, or when I was doing my college, right? I mean, I never understood like what was happening at the industry. We all learned different concepts. Not often you will get this opportunity to understand, right? So I feel there is an opportunity. So whatever you're doing right now with this club, I would say that's a very good initiative. Try to talk to many industry people, industry leaders, and, you know, try to understand, so that when you graduate you will have good experience of what to expect in real world, not just about knowing the concepts, but you would know how everything will fall in place and fit together properly to, you know, deliver big things.
Absolutely. Thank you so much again. Oh, did you have something to say?
Um,
Oh, sorry. Thank you so much again. We really do appreciate you coming to speak with us and being our first speaker too. So thank you so much, and we do really appreciate it.
Thank you for taking time. I know it's 6 o'clock, 7. I mean, almost close to 7, right? I mean, thank you for taking this time.
Of
And thanks for
course,
patiently hearing me.
of course. And I will send you all of the information for the meetings, our flyers, and hopefully the recording too.
Perfect. Okay. Thank you so much.
Thank you so
Yeah,
much.
thank you.
Have a good night.
You too. Bye bye.
Thank you. Bye.